Okay, the session is being recorded, so whenever you want to have a view or review of this thing, we will be able to do it again later. So now the time is 9:31, so I'm just waiting for another 3 minutes so that whoever is joining can join in and get advantage of the session. Thank you for joining. So I'm just waiting for 1 or 2 more minutes so that we can have all the students joining in, and then we can start the session. Doesn't matter that I have just given it for 1 hour. So in case if you have more questions, we can extend for another 15 minutes or 20 minutes. No worries about that. Okay, now the session is going to be recorded. Now let me just go through the physiology lab manual. So today we are planning to discuss the blood pressure recording and the arterial pressure examination. I hope all of you have just gone through the lab manual. So today I'll be discussing how the blood pressure is being recorded and what are the most important points which we need to note while recording the blood pressure, and also what are the possible questions which are usually asked for the OSPE examination. So these are the things which we will be discussing today. So now let us go through this particular lab manual one by one. So it is the arterial pressure recording. Okay, so let us discuss about what is the blood pressure recording. What is the blood pressure? Right. Before that, I think I will go back and then I will just show a slide, and then we can go through the sessions one by one. Okay, I hope this slide is visible to everyone who have joined now. We have now 73 of you have joined in this particular session. Okay, let us start with the blood pressure recording. Now, what is blood pressure? Blood pressure is the peripheral pressure exerted by a moving column of blood against the blood vessel. So that is the definition given for the blood vessel, blood pressure. And if you see this particular picture, you can see that this is the picture which represents the cardiovascular system, which has got heart and which is having the arterial supply. Then it is having a venous supply. This is a closed compartment. The whole heart, its blood vessels, together it forms a closed compartment, which means if there is any change which is happening in any of these blood vessels, for example, if there is a pressure change which is happening in the arterial system, or if it's a pressure change which is happening in the venous system, it is going to affect the whole pressure system, right? Whole, because it's a kind of a closed compartment. The heart, together with the arterial supply and the venous drainage, it is completely, if you look at it, it is not opening anywhere. It is just a closed system. So in this case, any change in any part of the cardiovascular system is going to affect the blood pressure of the individual. Now let us see the important characteristic features of each one. Arteries, when you look at it, arteries, they are elastic in nature. What do you mean by elastic in nature? That means when blood pressure pushes the arterial walls, it is stretched. The arterial walls are stretched and then it can recoil back. So that is a kind of property, elastic property. Just like a rubber band, it will be expanding and it will be recoiling back. That is the characteristic property of the arteries. Now we have arterial system. See, arterioles. The arterioles are those vessels just before reaching the capillary, right? Just before reaching the capillary, that is called as arterioles. And arterioles are richly innervated by the sympathetic nervous system. Arterioles are richly innervated by the sympathetic nervous system. That means if the sympathetic nervous system is stimulated, the arterioles will constrict. And arterioles are said to be the seat of peripheral resistance. See, they are called resistance vessels. That means they are the one in the cardiovascular system which offers maximum resistance against the blood flow. Whenever the sympathetic stimulation is taking place, the smooth muscles in the arterioles constrict. When smooth muscles in the arterioles constrict, the resistance is more. That means the blood will have to overcome that resistance. The heart will have overcome that resistance if it has to move the blood. Sorry. If it has to move the blood in the forward direction, it has to overcome the resistance which is created by the arterioles. And what is the characteristic feature of the capillaries? Capillaries are called as exchange vessels. And this is the place where all the exchanges will be taking place. The gaseous exchange, or if they want to exchange any nutrients, every forms of exchange in the cardiovascular system takes place within the capillaries. So capillary, as you know, it is a single layered, an endothelial layer is there, and it is easy for the gases to cross across, right? So that will be happening. So they are usually called as exchange vessels by function. And the veins, we call it as capacitance vessels because it has large capacity to store the blood. It has large capacity to store the blood. So when blood is accumulated, it can expand without recoiling. So that means if you see usually the lower limbs, we have larger veins, and these larger veins are capable of storing so much amount of blood. So they are usually called as capacitance vessels. Veins are called as capacitance vessels. So this is the basic plan of the blood vessels in the circulatory system. So we have elastic arteries, then we have resistance vessels, which are the arterioles, then we have exchange vessels, which are the capillaries, then we have capacitance vessels as the veins. So this particular picture you need to keep in mind before we go further describing about the blood pressure. Now, as definition, when we look at it, the blood pressure, it is the force or pressure exerted by the blood on the blood vessel. The lateral pressure exerted by a moving column of blood on the lateral walls, on the walls of the blood vessels. So that is what we call it as the blood pressure. In between, if you have any doubts or clarification, you are most welcome to just send a chat message. So I will respond accordingly. So we will clarify today. Don't have to worry. We'll do everything according to your need. Now let us see this part. Here you can see that aorta is having maximum amount of pressure because that's the largest artery, and it is having maximum pressure development. And then come the arteries. Arteries, the pressure will be lowered. When it comes to arterial, the resistance will be more, because I mentioned that the sympathetic innervation is very high in the arterial. So depending upon the diameter of the arterial, if it is constricted, it will be having more resistance. So that, but the pressure wise, when you look at it, there is a gradual fall of the pressure when you come from the aorta, arteries, arterioles, and capillary. Capillaries will be having the least amount of pressure. One thing is that it is single layered, so if the pressure is very high, it can rupture or break the capillaries. So we don't want the capillaries to have a high pressure system. Then in the veins, usually they are considered to be a low pressure system. All these sessions are recorded, the whole thing. So whoever is joining late, for you, nothing to worry. You have whole 1 hour session will be available for you later. So this one, so first we will go through these slides, what is uploaded, and then we will be discussing about the procedures and how we will be recording. Now let us see the main pulse point. What is the pulse? Pulse is the expansion and elongation of the arterial wall in response to the pressure waves which is created. The pressure waves will be created when the heart starts pumping during the systole. A pressure wave is created, and that pressure wave will be moving through the blood vessel. So that is the pulse. The pressure wave will be moving, and it can be felt in the peripheral locations, and that is the pulse. We have different types of pulse in the body, and in this picture you can appreciate that the central pulse is that's the common carotid artery, where you can test here. That's the location where you will be seeing the pulse examination. Then the facial artery, you can do the pulse examination. Temporal artery, on the temporal region, you can have the pulse examination. So these are the, then we have so many different peripheral pulses, and the most commonly used one will be the radial arterial pulse, radial artery pulse. So we will learn about how we can record a radial artery pulse. And in the blood pressure reading, the radial artery pulse and the brachial artery pulse. So these are the most commonly used one. So brachial artery will be the pulse when you palpate on the brachial artery. When you palpate on the radial artery, that is the radial pulse. So pulse is nothing but it is the expansion and elongation of the arterial wall in response to the contraction phase of the heart, and the pressure waves will be generated. So they are actually based on the pressure wave, right? So this is actually not the blood which is felt here. It is the pressure wave which you are feeling it. The pressure wave which is created during the systole, that is the one which you are feeling as the pulse, not the blood exactly. So this is the location. Then you can see various other locations like femoral arterial pulse, femoral artery pulse. So that is the femoral artery. Then popliteal artery pulse recording. Then posterior tibial artery and dorsalis pedis. So these are the various locations in the body where you can see the pulse, right? Usually the common carotid artery pulse, it is examined in case if you want to see whether the heart is still beating or not. You need to check the common carotid. So suppose if you see a patient lying down unconscious, so you need to see whether his heart is beating. So the easy way to check is to feel for the common carotid artery and feel for the carotid pulse. So if the carotid pulse is not there, that means the heart is not beating. So that is an indication. So those things will be used in various situations, but usually in the blood pressure. Yes, someone has written, let me just check the volume of blood is not related to the blood pressure. Yes, of course, the volume of blood, this is a good question by Mahmoud. The volume of blood is not related to the blood pressure. So that is his question. Is it not related to the blood pressure? Yes, the volume of the blood has very much to do with the blood pressure, because in case if the volume of the blood decreases, your blood pressure also decreases. Because as I mentioned from the beginning also, the heart its blood vessels, everything is a closed system. So if you just take out some blood from that particular system, in cases like, for example, if there is a hemorrhage, the person met with an accident, he lost the blood. So the volume of the blood is taken out from that particular system, definitely the pressure will be lower. That is why you are seeing that in those cases of emergency patients, we are seeing that the blood pressure will be lower whenever the person loses the blood, right? So we need to supplement this lost amount of blood in the form of the infusion, the IV fluids, and things like that, and blood transfusion. These are the ways by which we can replace the lost amount of blood. I hope I clarified Mahmood's doubt on that. So let us continue. Okay, so we are here. Now let us see what is arterial blood pressure. Arterial blood pressure, if you look at it in the adult individual, it is 120 and 80 is the range what is mentioned. And 120, we have got the systolic blood pressure. We have got the systolic blood pressure, which is 120. What is the systolic blood pressure? Systolic blood pressure is the maximum pressure exerted by the blood during the cardiac systole. What is systole? Systole is the contraction phase of the heart. During the contraction phase of the heart, the maximum amount of blood pressure exerted on the moving column of the blood. So that is called as a systolic blood pressure. And that is usually the range is like it is given, the average value is about 120. Now, what is diastolic blood pressure? Diastolic blood pressure is the minimum pressure exerted during the diastole or the ventricular relaxation. Now, this is a very, very important point to remember. This is a very important point to remember here. Diastolic pressure. Now, how can you record a low arterial pressure during ventricular relaxation? I want someone to type the answer if you know the answer, or if anybody want to speak, that is also possible. So my question is, the systolic blood pressure is the maximum pressure exerted during the ventricular contraction, the maximum pressure exerted on the blood vessels during the contraction phase, ventricular contraction. And diastolic pressure is the minimum pressure exerted during ventricular relaxation. Now, when the heart is in the diastole or in a relaxation phase, how that minimum pressure is exerted? This is a very, very interesting part. When the heart is in the relaxation phase, how can you expect? Yes, Mustafa, when the aortic valve recoil, it gives the diastolic pressure pushing the blood flow. Excellent. This is the correct answer for that. So I can just show you or share that particular slide. So that's a very good response by Mustafa. He has given the right answer regarding how diastolic pressure is exerting. Diastolic pressure, as a definition, it is the lowest pressure or a minimum pressure which is exerted by the heart during the diastolic phase. So my question was how the diastolic pressure is exerted when the heart is relaxing. So Mustafa has correctly pointed out that point. I just wanted to share one more slide which shows that. It is one which is called as a Windkessel effect. It is Windkessel effect. So this one we are talking about the aorta. This is the aorta. So you can see that during ventricular systole, what will happen? Ventricular systole, the ventricles will be contracting, ventricles will contract and it will be ejecting the stroke volume into the aorta. It will be ejecting the stroke volume into the aorta. The aortic walls will expand. So you can see from this particular picture that the aortic wall is expanding. See all these arrows, you can see that it is expanding the aortic walls during the ventricular systole. Now, what happens during the ventricular diastole? During ventricular diastole, what you are seeing is when the heart is in relaxing phase, this phase, heart is relaxing, but the heart cannot generate any pressure. But at the same time, what you need to remember is the aortic valves will recoil back. The aortic valves will recoil back. Here in this phase, you are seeing the aortic valves will be stretched during the stroke volume. When the ventricles are pumping the blood or ejecting the blood into the air, the aortic valves will be stretched. And during the ventricular relaxation, the aortic valves will recoil back. And it is this particular pressure which is called as the diastolic pressure. It's actually created by the elastic recoil of the aorta. So that will create that minimum pressure which will be helping the blood to move forward, right? So that is very important. So now I will go back again to the previous slides. So that is a very good response, a very good answer. Okay. So this one, okay, so we were discussing on this part on the diastolic pressure. Then the pulse pressure is the difference between the systolic pressure and the diastolic pressure. If you get a systolic pressure, if you get a diastolic blood pressure, if you just subtract, you get it as the pulse pressure. And then comes the mean arterial pressure. Mean arterial pressure is the, if you take the diastolic pressure and if you take the 1/3 of the pulse pressure, diastolic blood pressure plus 1/3 of the pulse pressure, we get this particular pressure of mean arterial pressure. So it is the mean arterial pressure which will be giving, like a mean arterial blood pressure is the one of the very important pressure that will be determining the amount of blood which is flowing through each like organ. It is the perfusion pressure, or it is the determinant pressure which determines how much amount of blood should go through organ. So the mean arterial pressure is very important. So it is, the value is the formula is diastolic blood pressure plus 1/3 of pulse pressure. Pulse pressure is systolic minus diastolic. So if you take 1/3 of the pulse pressure and if you add with the diastolic blood pressure, we get the mean arterial blood pressure. And it is the mean arterial blood pressure that determines how much amount of blood should perfuse through each organ, should flow through each organ. So that is important. Now let us see what are the different variations in the blood pressure. So if you look at this, the normal range 120/80, the 120 is the systolic blood pressure. This is the systolic blood pressure. 80 is the diastolic blood pressure. There are various situations like hypotension when the blood pressure is lower than the normal range. A low systolic pressure, you can see that if the systolic instead of 120, if it is going to a lesser value, 90, it's a very low systolic blood pressure, hypotension, and low diastolic from 80 if it is going below 60 millimeters. And these kind of things, various disorders are there where there can be, or some endocrine disorders are there where there can be hypotension. Then hypertension. Hypertension is a very common kind of situations where the blood pressure go beyond the range. A high systolic pressure above 130. Now this particular value I wanted to highlight because this was a value which was changed in 2017. Till all those years, people were having the normal range as 100 to 140 was considered to be a systolic blood pressure value, and 60 to 90 millimeters of mercury was considered to be a diastolic range. Now that value has changed in 2017 by American Cardiological Society. They have changed the particular value, and now we are following the new guidelines. So here, a high systolic value, anyone who is having a systolic blood pressure of above 130 is considered to be hypertensive. It is actually hypertension stage 1. Then high diastolic will be anyone who is having diastolic blood pressure above 80, this will be considered to be hypertension. So you can see this particular chart, and this is from the American Heart Association. And if you look at this, according to the guidelines in 2017, they have changed. So that means anybody who is having a blood pressure between 120 to 129, the systolic blood pressure 120 to 129, it is elevated. Still, they are not hypertensive. Elevated blood pressure, that means they have more chances to develop hypertension. That is what it indicates. Elevated means and less than 80. So it should, this diastolic blood pressure should be always less than 80. Now diastolic blood pressure, now what determines the systolic blood pressure and what determines the diastolic blood pressure? Systolic blood pressure is the actual finding that it is the reflection of the cardiac output. The systolic, the main determinant factor for the systolic blood pressure is the cardiac output, and the main determinant factor for the diastolic blood pressure is the peripheral resistance. That means if you have more peripheral resistance, you will have more diastolic blood pressure. If your heart is contracting more powerfully or more forcefully, then the stroke volume will be increased, cardiac output will be increased, and then the systolic blood pressure will be increased. So that is the relation between the systolic blood pressure and the diastolic blood pressure. So the systolic blood pressure is a pure indication of the cardiac muscle activity, the force of contraction of the heart, the systole, right? So that is more important. It determines, it is the cardiac output is the main determinant factor, whereas in diastolic blood pressure, it is the peripheral resistance which is more important. Now, look at this particular value. In this case, hypertension stage 1. When blood pressure systolic value is 130 to 139 millimeters of mercury, they are categorized as hypertension stage 1. And if the diastolic blood pressure is between 80 and 89, that is also considered as the hypertension stage 1. So this will be a diastolic hypertension and this will be a systolic hypertension. The clinicians, when they consider, for them, if you have any change, any increase in the diastolic blood pressure, that is more dangerous than the systolic blood pressure. Why it is more dangerous? Because as I mentioned before also, I told that the diastolic blood pressure, the most important determinant factor is the peripheral resistance. If you have a high diastolic blood pressure, that means he is having a very high peripheral resistance, and his heart will have to overcome that resistance by increasing the power of contraction. Right? Muscle contraction has, the heart has to overcome the resistance by increasing the force of contraction. So that means the workload on the heart is much more in the diastolic hypertension situation. Now, in this case of stage 2 hypertension, you can see 140 or above. 140 or above, it is stage 2 hypertension of systolic hypertension, and 90 or higher in the case of a diastolic value, that is called as a diastolic hypertension stage 2. So stage 2 is from stage 1 onwards. You need to be very, very careful. Even if it is the blood pressure is elevated stage, you need to be careful. You need to do regular exercise and dietary control and everything. And those who are in stage 1, you need to be careful. Once you are in stage 2, it is more serious situation. Then you can see that the last stage will be the hypertensive crisis, which is having higher than 180. It's a very serious critical situation that anything can happen to this particular patient, right? So higher than 180 of systolic value and higher than 120 of systolic value. It's a very, very high blood pressure. So this is a very critical stage. So these are the guidelines recommended by the American Heart Association in 2017. So if you see some of the older books, they will have a different value. I don't want you to read that. I want you to know the new and latest value, which is used in the clinical practice nowadays. In 2017, the guidelines have been changed. So this is very important. Now let us see the blood pressure recording. What are the important tools which we will be using for the recording? We know that we need to have a sphygmomanometer, which is the blood pressure recording apparatus, and we have different types of sphygmomanometers. We are not using this one. This is a mercury manometer, which we are not using in our lab, but this is a very accurate way of measurement. We will see in the hospital side, even some of the latest even if you have the electronic devices, this is considered to be one of the best, the manual method. Now this is the recording cuff, the blood pressure recording cuff, along with the aneroid. This is the aneroid sphygmomanometer, which will be where there is no mercury which is involved, and this is an electronic source of recording. So we have different types of recording which is available. In that, the electronic one, you don't have a prior knowledge of how to record it, but the manual method, of course, you need to know the skills, you need to learn the skills. But since this is a particular live session, so we don't have any opportunity of recording that, but I'm sure that once the college and university reopens, I'm requesting everyone to go to the physiology lab, and you have to record it, because though you say that we have the electronic devices, why we need to know this? But the importance is that as a clinician, when you start recording, when you finish your course and when you start practicing, you will definitely require at some point of time, if the electronic devices are not working, and if you are in a primary center where you don't have any facility, you have only a manual recording instrument. So those kind of situations, you need to save the life of the patient. So it is very critical and very important to know the recording manually. So this is, as a clinician, you have to know. There is no other go that you have to know how to record, because this is the matter of life and death of the patient. Now let us go to the parts of the sphygmomanometer. So we will see that the sphygmomanometer, this is an aneroid sphygmomanometer. So in that, we can see the first one is a blood pressure recording cuff. A blood pressure recording cuff is there, which is inflatable. We can use a particular pressure pump, and there is a valve. Valve is there, a two-way valve. You can see that air will be entering in this direction inside this particular inflator, and then it will be there is a particular screw here which can be used to rotate, so that it will be air will be moving inside this cuff, and then inflation will be taking place. So that is how the cuff is, and the cuff wrapping of the cuff is very important. So I think we will go to the procedure part, and we will explain, so that the things will be clear. I'll just go to the manual. Let me go to the manual, and then one by one we can record. One by one we can explain, so it will be clear to you. Okay, so let us start now. Okay, so we will be now looking at, so for the recording, we need to have a blood pressure recording device, an aneroid sphygmomanometer. We need to have a stethoscope. We need to have a stethoscope. Then appropriately sized blood pressure cuff. This is a very important matter. Now, when we are using the particular cuff, you need to make sure that the cuff is appropriately sized. Now, let me show you a picture. So this is the picture of the aneroid sphygmomanometer, which we will be using. This is what you might have seen in your labs. And if you see, there is a cuff like this. Different cuff sizes are available, right? So this is a standard adult cuff size which is available. So if you see here, so this is the 11 or the standard cuff size. There is a picture which is given on the cuff. And if you see that, it is having two different ranges. It is having two different ranges, right? So from, if you are taking 12, that is the standard adult size. Suppose you get an individual who is very huge. His arm size, his or her arm size is very huge. You cannot use the same adult like this one, this particular cuff size, because it will be so tight when it is tied over the arm, right? So when it is when you apply so much of pressure and tie a cuff, the recorded blood pressure will be of error. You will not get a proper recording. So that means you need to use a proper cuff size according to the size of the individual, according to the physical build of the individual. That means if you have a small child who is coming for the recording, right, a small toddler who is coming for the recording, or a pediatric like cases when you want to record. So in such cases, you need to remember that you need to use a smaller cuff. So you can see that there is a pediatric cuff which is available, which is size 6, right? We are using size 11, but you have different ranges from 13 to 6. We have different ranges which is going on. So appropriately size has to be appropriate. So this is very, very important. So this is the manual aneroid sphygmomanometer which will be used, and you will be first selecting the correct size. And here we have the standard as the 11 size is available, which is usually used for the standard ranges. Then you need to know the parts of a stethoscope. Stethoscope is very important to use during the auscultation. So in the stethoscope, it has got a bell. You can see that there is a bell which is usually used for low frequency sounds. Low frequency sounds, we usually use this particular bell. Some of the hard sounds will be heard by those particular part. And the flat portion, this is called as a diaphragm, which is the high frequency sound. So high frequency sound, here for the blood pressure recording, we usually use the diaphragm of the stethoscope. So this particular portion has got a bell and a diaphragm. So in this case, in this particular experiment, we need to use the diaphragm. Diaphragm is the one which is usually used. Then we have earpieces. We have got the earpieces which will be kept into the ear, and these are the things. And here usually in our stethoscopes, you will be seeing that there is a lock which is available, which no one will tell you. That's why I'm telling you here that here there is a lock which is available in the stethoscope, which is the lock between the diaphragm and the connecting the PVC tubing. You will see that there is a lock here, the one where the arrow is there, right? So this particular part, you'll be having a lock. So this lock has to be opened. So if you open that lock, and when you tap, how to check that whether the lock has been opened? You have to just turn it. You can either turn it to clockwise direction or anti-clockwise direction, and you can check that. How you can check? You can just keep the stethoscope earpiece should into the ears and gently tap on the diaphragm. Gently tap on the diaphragm, and then you will be able to hear. If you are able to hear it, the tapping sound, then it is understood that you have opened the lock. If it is in a closed position and when you tap it, you cannot hear anything. So before starting the experiment, this is the most important thing which you need to do it, because most of the times when we do this recording in the lab, the students will say that I'm not able to hear the recording sounds. Now this is because you might have closed the particular valve. So this is important. Now after, when you start the recording, how will you read the blood pressure? This is again a very important point. This is how the recording dial looks like, and from this you need to read the blood pressure, right? So here you can see that there are graduations on it. From 20, you can see from 20 it is 20 to 40, right? 20 to 40, and in between this line, that will be indicating how much it is. It is 30, right? So this will be 30, right? So 20, 30, 40. Then what will be the each small lines? Each of these small lines indicate 2 millimeters. So each of the small lines is indicating 2 millimeters. That means it will be 20, 22, 24, 26, 28, and 30. Remember, whenever we are recording blood pressure, and when you are asked to see the blood pressure from the dial, never give any odd value. Every time you get an even number, right? If you say me that I got 45 as the blood pressure or 65 as the blood pressure, I will tell no, you are lying. You are not done it, because here every time when you are recording, you get it as even numbers, right? It should be like 46, 48, or 68, 78. It should be even numbers because each small lines indicates 2 millimeters of mercury. So you will never get an even number, and every recording of the blood pressure should be indicated in millimeters of mercury. This is important. No recording should be reported without writing the units. If you don't write the units, that doesn't have any value. So usually in OSPI, we might keep such kind of like a recording, like one of the dial where there is a indication like this, right? So it will be kept here, and then you will be asked to read out. Now, how much is the blood pressure which is shown in this particular picture? Now you should tell me how much is the blood pressure shown in this particular picture. Anyone can type. Anyone can type what you see in the picture. What is the blood pressure which is shown in this particular picture? 70? Some other answer? Yes, 50 millimeters. 70 is here. Right? See, 70 is here. Right? This is 70. Right? So this is 40. This is 40. This is 60, and this one should be 50, right? So here it should be 50 or 50. So 50 millimeters of mercury. That is the correct answer. So yes, it is true that 50 millimeters is the correct answer. So reading from the dial is very important, right? Reading from this particular dial. So remember that every small graduations is indicating 2 millimeters. So every time you get an even number when you're recording, right? So that is one thing which you need to remember here. Then let us go to the next part. Okay, now when you start recording, first thing what you will record, you will be first feeling the pulse. First you will be feeling the pulse. Pulse should be felt by a 3-finger method. You'll be seeing which pulse is felt here. It is the radial pulse which we are examining here. Using the 3-finger method, you can see that the 3 fingers are used. You can see that this finger is usually pressed against the bone. This is pressed against the bone, and then the middle finger is actually used for feeling the pulse, right? Middle finger, and this one is the usually used for feeling the pulse. Then what is the use of this first finger here, right? This you are pressing. This is actually, it is said that when you press this particular finger against the bone, what will happen is in this palmar region, in this particular palm, you can see that there is a superficial palmar arch. If you have learned the anatomy of this palm, you can see that there is a superficial palmar arch which usually produce a kind of pulsation. It is having a kind of pulsations, and these pulsations might try to interfere with the radial pulse. So what is happening is you press this particular finger against the bone. This interference of the superficial palmar arch pulsations will not be interfering with the pulse which is actually recorded in this part. So this particular finger, the middle finger, is the one which is actually we are feeling the pulse, and the first finger what you are keeping here, and this particular finger is the place where you are pressing and you are cutting off the pulsations coming from the superficial palmar arch. So that is the reason why whenever you are recording the blood pressure, always make sure that you use the 3-finger method. So the first finger what you keep, press it against the bone so that the pulsations coming from the superficial palmar arch is cut. Then you are actually feeling the pulse using this 2 fingers, right? So that is the theory behind it. That is why always we are using a 3-finger method for recording. So this is now let us go to the file where we actually record the lab manual. We'll just go through one by one so that it will be clear to you. Okay, now we need to just see what are the thumb rules. What are the thumb rules? First thing you will be doing is introduce yourself to subject. This is very important. Who are you and what you are planning to do, and you have to take a consent when you start doing the recording. First, that I'm planning to record the blood pressure, and this particular procedure is a painless procedure. Although you might find some kind of like a uncomfortable feeling might be there, but it is okay. It is not a painless procedure. So these kind of things you need to tell before you exactly start the recording, and then you need to take the consent, and also that particular part of the arm has to be exposed. If he is wearing clothes, the shirt or anything, he need to lift, roll out that particular sleeves, and then only it should be recorded. So that recording particular area should be exposed, because if you have a tight sweater or something like that, then the blood pressure which is recorded may not be clear. So that consent has to be taken. Then you have to make sure that appropriate cuff size is being used. That has to be used. Then after that, you have to make sure that the cuff has to be tied. Cuff should not be too loose or too tight. This is also very important one. It should be it should be proper. That means if you can insert two fingers, the examiner can insert two fingers inside the cuff. That is the ideal way to tie the cuff. If you cannot insert two fingers into the cuff, that means that the cuff you have tied on the arm is very, very tight, right? So you need to make it a bit loose so that you can examiner can insert two fingers into the cuff. So this is important, right? Then always make sure that this point is also important. The sphygmomanometer dial must be facing away from the subject so that it can minimize the amount of anxiety. Now, what will happen? I have seen, like in most of the places, even in our hospital, some places when the nurses record the blood pressure, they just keep the dial of the blood pressure recording towards the patient. So this will cause a lot of anxiety in the patient, because you have to understand that the patient is already anxious because they are not well, they are unwell, and they have come to consult you. At the same time, you are showing that his blood pressure is very high in front of, so this will give a kind of a panic vibes, and this might increase his anxiety. So always make sure that the blood pressure recording, this particular dial of the sphygmomanometer, should be facing away from the patient, and it should be facing towards you, because you are the one who is recording it, you are observing it. So this is important. Then after that, make sure that the subject is relaxed, and at least for 5 minutes, because here, as soon as the patient comes into your clinic, you will not record. Here also in the student clinic, what you have seen here in the student clinic, when you went for the, like any checkup or anything, the first preliminary evaluation will be your blood pressure recording. They will call your name. You will be asked to wait for some time. Then they will call your name. Then they will record your blood pressure. Height and weight will be taken, and it will be measured, right? So this one is done in this procedure because we don't want the blood pressure to be very high as soon as they arrive. And when you start recording, most of the patients will be having a high blood pressure, because we don't know how they have come. Some people might have been running, some people might have climbed the staircase. So all these things you need to keep in mind. You have to ask the patient to relax first. After 5 minutes, you will be recording the blood pressure. You can see that. So this, whatever I have mentioned in this particular lab manual, it has to be followed very strictly. That here you can see remove excess cloth that might interfere with the BP recording. So all these points you need to keep in mind. Then the parts of the stethoscope, already we have seen that it's having a diaphragm and the bell, and in this experiment we'll be using the diaphragm, the flat area. So that is the one which we'll be using. Then this is the aneroid sphygmomanometer which will be used, and already we have seen that. Now let us see the first method, which is the palpatory method. Palpatory method is we are doing the palpation, we are touching the subject and doing the examination. So any examination, when you are touching the subject, when you are touching the patient, that is called as a palpatory method. So here you will be wrapping the blood pressure cuff around his arm, and then how you will be tying it, you have to make sure that the cuff is tied not too tight or too loose. This is very important. This is not, it should not be too tight or too loose. And then what you will be feeling is, using the 3-finger method, you will be feeling the pulse first. You'll be feeling the pulse, taking the pulse rate. For 1 minute, you will be counting the pulse. And after that, what is done is, you will then inflating the cuff, right? So here you can see it is mentioned that radial artery then elevate the pressure. So you will be increasing the pressure, and when the pressure increases, what will happen? The cuff will be inflated, and cuff will be inflated, and cuff will be obstructing the brachial artery. So you are tying the cuff exactly on the brachial artery. That means that the rubber bag which is being inflated, that should be exactly placed on the place of the, that is the medial aspect of the arm. So the medial aspect of the arm, we have the brachial artery. So that particular part should be kept in such a way that the inflation will be compressing the brachial artery. So when the brachial artery is compressed, what will happen to the pulse? The pulse will disappear. So here you can see that in this part, this point is important. Increase the pressure in the manometer by inflating the cuff. Note carefully at what pressure the pulse disappears. So at one point of time, when you increase the pressure, you will see that the pulse will disappear. When the pulse disappears, what you will be doing is, you will be elevating the pressure again 20 millimeter more than that particular value. Suppose at a value of 100, if the pulse disappears, you will be increasing 120 millimeters. Now, let me repeat the procedure again. After tying the cuff, feel the pulse. When you feel the pulse, then you start inflating the cuff. Inflate the cuff, and then the pulse will stop. Once the pulse will stop, you need to note that particular point, at what point the pulse stopped. Then you will be increasing 20 millimeter above that value where the pulse has stopped. That means if at 100 millimeters of mercury, if you see the pulse disappears, you will be raising the pressure to 120, right? So that then what you will do, you will slowly release the pressure. You will slowly release the pressure. Now gently release the pressure. So the releasing the pressure should be at this particular 2 to 3 millimeters of mercury per second. So this should be the rate at which when the reading is observed. Yeah, see here, so listen to this carefully, Mahmood. Now, when you first feel the pulse, after that, do the inflation. Increase the pressure, do the inflation, and one point of time, no longer feel the pulse, right? The pulse will disappear. You have to note the point at which the pulse disappears, right? And note the point the pulse disappears. After that, you will be increasing 20 millimeters of mercury more than the pressure in which the pulse disappears. That's why I'm giving an example. Suppose at 100 millimeters of mercury, the pulse disappears. Suppose at 100 millimeters of mercury, the pulse disappears, you will be still raising the pressure to 120. After that, slowly, you'll be releasing the pressure. When you slowly release the pressure, again, when it reaches 100, the pulse will reappear, right? Note at what pressure point the pulse reappears. So at this point, right? Note at what pressure the pulse reappears. Now take the average of both these readings, and then you will be getting, usually what is seen is the appearance and the disappearance. It will be usually at the same point, only there is a very slight variation will be there, and this is how you will be recording the systolic blood pressure. So once again, I'm repeating this systolic blood pressure recording by palpatory method. That is, when you are feeling the, first you have to feel the pulse. After that, you have to increase the pressure. You have to note at what point the pulse disappear. Then you will be increasing the pressure to 20 millimeters more than that value. Then you will be releasing the pressure at a slower rate, like 2 to 3 millimeters per second. In that rate, you'll be releasing the pressure, and at one point you will see the pulse will reappear. Usually disappearance and appearance of the pulse will be at the same point. If there is a slight variation, you need to just take the average between these two, and that will give you the systolic blood pressure. Now the question is why you need to do this 2 times. If you disappear, say first I have done and I disappear, and immediately the pulse disappear, and immediately you can note it down. Why you need to increase the pressure and again you have to come back. Now when you are feeling the pulse, the appearance of the pulse is more easier to locate. It can be felt. The appearance of the pulse is more easier to be felt than the disappearance. Disappearance, you need to have a lot of skills to find out the disappearance. It is, unless you are experienced, you will not be able to find out when the pulse disappears exactly. So there might be some error. So you need to reconfirm that particular point. So that is why you are doing it 2 times. That first you will be feeling the pulse, then you will be observing for the disappearance, you will be raising the pressure for 20 millimeters, that you will be coming back till the pulse reappears. So this point is the place where you will be recording, or we will be writing it as the systolic blood pressure. Very important point here to make is you will not be able to get the diastolic blood pressure by palpatory method. Right? That means only one blood pressure, the systolic blood pressure, only can be recorded by the palpatory method. You will not get the diastolic value. Only the systolic blood pressure you can record. Diastolic blood pressure cannot be recorded by this method. So we will see how it can be recorded. Right? We will be seeing now. Let us see. Okay. Palpate. So the palpatory method is done like this. So you will be feeling the pulse, then you will be increasing the pressure, then you will be noting the point where the pulse disappears, raise the pressure to 20 millimeters, more than that value, again release the pressure till the pulse reappears. So that point you'll be taking it as a systolic blood pressure. Now you do the next point, which is the auscultatory method. Auscultatory method, you will be using the stethoscope, and then you will be recording it. Now in this particular method, you will be, again, you don't have to remove the cuff because the cuff is already tied. Now you already know that the pressure, the systolic blood pressure, his value, you already know by the palpatory method, because we already get it by the palpatory method, right? Suppose if the patient is having 100 is the recorded systolic blood pressure, you have noted. Now what you will be doing is you will be increasing the pressure to 20 to 30 millimeters of this particular value. That means if the systolic blood pressure is 100, you will be raising the pressure to 130 millimeters of mercury. So that is how this will be done. And then you will be placing the stethoscope. You will be placing the stethoscope over the brachial artery. See here, this is the brachial artery. So you will be keeping the stethoscope over the brachial artery, the diaphragm. So the diaphragm is the one which is placed. So you can see that this is the diaphragm, and that is placed over the brachial artery. So in this particular experiment, which blood vessel is being auscultated? It's actually the brachial artery is being auscultated. So first you need to do is you need to palpate the brachial artery, you need to feel the brachial artery, and then you need to place the diaphragm. Now how will you feel it? For that, I want all of you to feel your biceps tendon. You flex your arm. All of you have to flex your arm. You can feel on your hand, right? Feel on your right hand with your left hand, and left fingers. So you can just flex your arm. Try to right arm, you flex it, then you feel the biceps tendon. Can you feel the biceps tendon? After you feel the biceps tendon, you keep 2 fingers medial to your biceps tendon. That means towards you. Medial means it is towards you, right? Closer to your body, right? So first feel the biceps tendon, then you keep 2 fingers medial to the biceps tendon, then you extend the arm. Then when you extend the arm, your fingers will be exactly on the brachial artery. You can feel the palpations, you can palpate palpate it, we can feel the pulsations also when you press it hard, right? So that is the way how you will be locating the brachial artery, and it is that particular point you will be keeping the diaphragm. That is the ideal way to record. Then once you keep that, you will be recording. Then you will be seeing that, as I mentioned here, in the palpatory method, you got already the systolic blood pressure, right? If it is, suppose if it is 100, you will be raising the pressure to 130 millimeters, 30 millimeters above the systolic value. Then you will be keeping the stethoscope, the diaphragm of the stethoscope on the blood vessel. Then you will be slowly releasing the pressure at the rate again 2 to 3 millimeters until the first Korotkov sound is heard. Now, this is a kind of sound which is called as a Korotkov sound. Korotkov is a Russian scientist who first discovered this sound. That is why it is considered his name is given for that particular sound. His name is Korotkov sound. So the first audible Korotkov sound. So you need to remember that there are different qualities of sound. So the first sound, as soon as you hear the sound, that is an indication of the systolic blood pressure, right? So here in this particular method of auscultatory method, you are determining the blood pressure based on the sound. So this is a skill. You need to learn the skill. So this is very important. Now, let me just go back to one of the YouTube video and just to have a look at it so you will get an idea. Let me open it. Wait a minute. I'll just share it. So appropriate cuff size is used. Okay, so I was just, were you able to see that particular video? In case if you have not seen it, I have already shared it in the link to you in the Blackboard. So this is also one way which you can learn. So it was just a procedure just to see, just to show how a palpatory method is done and how an auscultatory method is done. Now we were discussing about the auscultatory method, and if you were able to hear the Korotkov sound in that particular video. It is just a kind of sound, duk, 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 that kind of one sound will be appearing. So here, let me explain this auscultatory method once again. Already by palpatory method, you have got the systolic blood pressure, and suppose if it is 100, you will be raising the pressure to like 130, that means 20 to 30 meters above the systolic blood pressure. After that, you'll be releasing the cuff pressure in a smaller rate, like 2 to 3 millimeters per second. Then you will start hearing the first Korotkov sound. So note down at that what point you hear the sound. That point will be taken as systolic blood pressure, and you will see a series of sound, and then the particular sound disappears. The disappearance is taken as the diastolic blood pressure. So this is important. The disappearance of the sound, the point of disappearance of the Korotkov sound is taken as the diastolic blood pressure. So here, diastolic blood pressure, remember that if you want to get the diastolic blood pressure, you have to use the auscultatory method. So the systolic blood pressure will be the starting of the sound, and diastolic blood pressure will be the ending or disappearance of the sound. So that is important. This systolic and the diastolic will be recorded. So in this method, we are able to record both systolic and diastolic method. So this is a very important procedure, and here it is shown about the characteristic of Korotkov sound. You can see that this is the different sounds. You can have 4 different sounds here. The first, clear tapping sound, then you have a louder sound, then the sound becomes more crisper and louder, then it will be muffled, right? Muffled means it will be towards the end. See, it will be initially starting like a sound, it will be like this. Then towards the end, you will see that the quality of the sound changes, right? That is called as a muffling. Muffling is just before the disappearance of the sound. You will hear the muffling sound. The sound quality changes as doof, 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 right? So once it stops completely, that is taken as the diastolic blood pressure. So systolic will be when the appearance of the sound, that marks the systolic blood pressure. When the sound disappears, so appearance is taken as a systolic and the disappearance is taken as the diastolic. Then you will be recording all these values: the age of the subject, name of the subject, the pulse rate, how much pulse you will be counting. Remember, when you count the pulse, you need to take a complete picture. That is count the pulse for exactly 1 minute. Though here we will see that particular part also, and this is the range which is already given to you. And let us see the pulse examination and this part we have already done. That what these are the different pulses which we can examine, like temporal artery, like facial artery, carotid artery, brachial, radial. So in this particular experiment, the brachial artery and the radial artery, this is more important. We are not looking at the other areas. And this is the normal heart rate. Normally 60 to 100 beats per minute is considered to be the normal heart rate. Then if the pulse rate is less than that, that means less than 60 is called as a bradycardia, and tachycardia when you have a high heart rate, right? For example, we have learned even in the endocrinology when we talked about the thyroid hormone. So thyroxine has an important influence on the heart rate, right? So when the bradycardia, if the patient is having hypothyroidism, his resting heart rate will be lower. So if you record a resting heart rate and if you find that it is less than 60, it is a kind of a bradycardia. You have to suspect that the patient might be having low thyroid hormone. If it is more than like 100, when the resting heart rate is more than 100, then you have to also suspect that when he is resting and his heart rate is very high, you need to think that he might be having some kind of endocrine issues also. So that has to be clarified. So this is and here the radial arm pulse has to be counted. So it is usually the 3-finger methods will be used for the counting. Now here, if you remember, in this it is written, see here, if it is rhythm, see here, if the rhythm is regular, it is safe to count the beats for 15 seconds and multiply it 4, right? That means when you are asked to measure the pulse, first thing what you have to see is you have to feel for the pulse, and you need to make sure that the pulse rate is normal. What is that rhythm? That means it should come at regular interval. Tuck, tuck, tuck. If you are able to feel the pulse at regular interval, then you can count the pulse for 15 seconds and you can multiply it by 4, and then you will be getting approximately in 1 minute what is the pulse rate. But sometimes it is not advisable to do that, because sometimes in the individual, if he is having irregular pulse or a very slow pulse, you can see in this situation sometimes it is irregular pulse, you need to completely count for a minute. But I would recommend that everyone, when you are doing this particular experiment, count for 1 minute, because we don't know who is regular and who is irregular, right? Which pulse is regular, which pulse is irregular. So it is better to be at a safer side, that you count the pulse for just 1 whole minute. This is important, and then record it. So, and these are the references which you will be seeing it later. These are all clinical books which you will be using it later. It will be there. And then, okay, so here anything else is there? Let me just, okay, so these are the important things which you need to remember. Okay, so this is again the same measuring part is mentioned here. Okay, so here the principle involved is when your when the blood vessel is obstructed, for example, brachial artery is obstructed here. When it is obstructed, you will not be feeling the pulse, right? You will not be feeling the pulse at all. Now, in auscultatory method, what is the principle used? Auscultatory method, you are using the stethoscope, and how these cough sounds are produced. Cough sounds are produced as a result of turbulence in the blood, because when the blood vessel is partially occluded, right here, you can see that in this particular picture, here brachial artery is now completely obstructed. Now, when you release the pressure, what will happen? Some amount of blood will be flowing to the brachial artery, and when the blood is flowing through a partially occluded blood vessel, it will create turbulence. Turbulence will be and this turbulent flow will create sound. Normally, when you keep a blood, like when you keep a stethoscope over the blood vessel, my question now, let you like I will be like asking you one question, and I want you to type if you are with me. If you keep the diaphragm of the stethoscope on a normal blood vessel, will you hear any sound? Any part of the body? There are blood vessels on our body. If you keep a chest piece over the chest piece of the diaphragm of the stethoscope over a normal vessel, will you hear any sound? What do you think? What is your guess? Doesn't matter if it is wrong. Mahmoud is no. Jafar, no. Yes, very good. Because those who have answered no, you are right. This is very good. Good response. Here, because when you keep a stethoscope over the normal blood vessel, you will not hear any sound, because the flow inside a normal blood vessel is a streamlined flow or a laminar flow. Laminar flow or a streamlined motion, that doesn't create any sound. But when you keep the blood vessel, when you keep the stethoscope over an occluded artery, a partially occluded artery, when the blood is flowing through a partially occluded artery, it will create turbulence. That turbulence is the reason for the correct cough sound. So that is very, very important, and that is the principle involved, and we are actually measuring the turbulence. So actually we are measuring the turbulence. So that is why this is how that principle is involved, right? The principle involved is the creation of the turbulence, and then the correct cough sound is recorded, right? So now let us, okay, so that you understood. So here these are the critical points which you need to remember. Okay, so then we go to the last part. Okay, so here you can see that when the blood pressure cuff is inflated, then initially you will see that it is completely obstructed. See, here it is completely obstructed, and then you are releasing the pressure here. When the releases the pressure, what will happen? Partially occluded blood vessel, it will start producing the Korotkov sound. So Korotkov sound will be seen. Korotkov sounds are created by pulsatile flow through the compressed artery, right? And when when completely it is open, the flow will again go back to the laminar flow. When it again go back to the laminar flow, then you will not hear any sound. The Korotkov sound will disappear. So that is the principle used in the auscultation method. But one thing is that here, the blood pressure recording, it is a skill which you need to do it and learn it, because just because the situations at the present conditions of the COVID-19 is making us to avoid the lectures and practical session. That is why we had to conduct this particular session in this way. Definitely, when you're back, we will be doing this, and I'll be teaching you how to do the recording. And that's all about this session. If you have any further questions, you are most welcome to contact me in any of these medium. My phone number is there, mobile number, Twitter, all these details are there. So you are most welcome to ask your questions or anything if you have. Do you have any further questions before we stop this session? We have actually exceeded 15 minutes. It's okay. I have another session at 12 o'clock. So hope you enjoyed this session, and if you have any further question, you are most welcome to ask me. There is no issues and nothing. So I always ask you feedback. Let me just take your feedback on this session. Let me just wanted to know. So hope you all enjoyed. But definitely, I know there's a lot of practical difficulties and things like this session, but still something is better than nothing, right? So I just wanted to take your honest opinion. Let me just see. So if you want to just try to, you feel free to answer your this thing. So we don't have any like that. So I just wanted that we can still. Okay, so thank you so much for your responses and your attendance. So this was one session which I had many students attending. I think we had at one point of time, I think more than 100 students had appeared in this particular session. This is really good, and this also shows your interest of joining. Okay, so thank you so much for this particular session, and we will again get back to the next sessions as and when which is required. So have a great day. Thank you so much.